And welcome back once again. Dr. Drew McPhail is here to talk about peripheral neuropathy. And I tell you what, this is something that a lot of folks don't know that much about. The layman's don't know that much about it. But I got to brag on you a little bit. I was at your office a couple of weeks ago up in Somerville, and the thing of it is, you have got machinery in there that help out the patient more than just about any other chiropractor I've seen in years and years.
Oh, thank you. Yeah, we try to bring the latest technology to help actually rehabilitate the soft tissues, the muscles, tendons, and ligaments. And with neuropathy, we have specific things we're able to stimulate the nerves and kind of bring them back to life. Neuropathy is basically, it's an epidemic in the United States at this time. Roughly 20 million Americans suffer from it. Now, what it is, majority of the neuropathy is a sensory neuropathy, which means the small nerves that innervate your skin and allow you to feel and touch things, these things are beginning to die off. So the common symptoms that the patients will experience will be numbness, tingling, burning sensations, balance issues. And that's a major problem because...
Especially for the older folks.
Right.
Yeah.
I mean, you fall, you break a hip,
and it takes a good while to respond to the healing and so forth. How are you treating an individual with peripheral neuropathy?
Well, the first thing we do is determine what type of neuropathy it is, because there's sensory neuropathies, which a lot of diabetics will develop the neuropathies due to decreased capillary function, which are the vessels that supply the nerves with oxygen and nutrients. And then there's compressive neuropathies, where degenerative disc disease in the spine compresses the nerves become compressed there, which you saw with some of our decompression units. That's what we're able to do, is decompress those nerves.
And let me touch real quick on the decompression unit, because I saw a couple of ladies that my understanding were having lower back problems for a number of years, and they're very relaxed on this table. And then there's a small system, belting type system that you put around their legs, and it just gives this little bit of easy tension to align the spine where it's supposed to be. And they're very relaxed and very comfortable. And when they both got up, they said, that's why we come here, is because we feel so good after this treatment.
Yeah, it really does help the patient, especially the ones that have had the chronic back pain, like the degenerative disc disease, the herniated disc, the spinal stenosis. But with our neuropathy patients, a lot of times there's some compressive factors as well. So this way we manage the nerves at the nerve root itself, and then we can also go into the periphery, into the extremities. Usually with peripheral neuropathy, you'll start in the toes and creep up the foot, and then up.
Like a tingling?
Tingling, numbness, burning sensation. I had one patient said it felt like he had lightning bolts coming out of his toes.
Oh, yeah, and that's painful. It's hard to go about in your day-to-day work, business, or anything, just almost life itself.
It's
with
debilitating.
all that tingling going on.
Yeah, I mean, it really put stress on their families, their relationships. Some of them can't keep a job because they're in so much pain, and they didn't know that there was anything that could be done to help them.
Wow. What are some of the ways that we can treat this? Okay.
Well, first thing we have to do is determine what the cause is and the type of neuropathy. And we're able to do this. I do a very specialized sensory-based evaluation with the patients to determine which nerves are affected and the extent of the nerve damage. And then from there, we have supplementation that we can use, vitamins and nutrients to help give the body what it needs so that it can heal, as well as we use low-level laser, which helps the capillaries function better. It helps capillaries open up, which gets more oxygen and nutrients to the nerves. I have the high-powered cold laser, the MLS laser, and with that we can actually stimulate the nerves to give them the energy they need so they can start to heal.
Yeah, tell us about that MLS laser, because that's a machine that you've had here. You're one of, I think, 2 chiropractors in the entire state that are using this now. It's literally painless. You don't feel anything. The only thing that's touching you is a light beam, and that's it. But yet, this stimulates the healing in the joints, my understanding.
Yeah, what it does, we're able to use it with the neuropathy patients to basically helps calm the inflammation down really quickly. It causes cellular respiration. But what it does, it goes into the power plant of the cells, which is called the mitochondria. It's like an organ in the cell. It gives it the energy it needs so that it can start to regenerate. Because as we age, we lose energy, right?
Yeah, exactly.
Okay. Well, we do it at a cellular level as well. So with this, we're able to kickstart those cells so that they can start to heal. And what we're finding is the patients are actually where they couldn't feel their feet at all. After a course of management, they can feel their feet again. They're able to stand. Their balance is better. They're not doing the guided walk, having to hold onto a rail and use walkers and
because
things like that.
They're feeling all kinds of pain whenever the neuropathy is going on, and they've got to get that relief. And but with the laser treatment in the joints, I know you treated me that one time, and I literally felt immediately relief right after that. And there was something nicer going on in my right knee, because my right knee right now is almost bone to bone from running and jumping out of perfectly good planes for 33 years. But what happens is that you are starting to restore that healing process in and around the bone itself, where they come together.
Yep. And like I said, it gets the inflammation out of there really quickly, so symptomatic relief is really fast. And like with the nerve cells, the cartilage cells, we can do the same thing. There's different settings for the different tissues that we're treating, but it's the same sort of thing, basically promoting the healing response and helping increase tissue growth.
Tell us about this free clinic that you've got this evening, starting at 3 o'clock, my understanding?
Yeah, at 3 o'clock at my office, I'm going to be talking about, we're going over neuropathy, and I want to go over what the common presentation is for the patients, what common conditions that could cause it, what some of the management is, and how we effectively manage it in our clinic. And it's totally free. It's about a 30, 45 minutes, depending on how many questions we have. We give people a tour of the clinic to let them see what we have, and just a
fantastic,
all-around good thing.
Very good. Dr. Drew McPhail, always a pleasure.
Thank you, Tom.
Up in Summerville area, give him a call, 873-2225. Now over to Aaron for some road tripping.
It's time to explore the Low Country.